Hello, it's Flora. You're welcome back to my YouTube channel. To all my returning subscribers, I say welcome back. And to all the first timers here, please smash the like button, smash the subscribe button, and leave your comments down below. All right, today we're going to be talking about diabetes foot care. But in my previous video, we had discussions on diabetes and microvascular complications. And diabetes foot care is one of the care we give to the diabetic patients who come to the healthcare provider for assistance and for treatment. Now, what is diabetes foot care all about really? Foot care is really a very important care for all persons with diabetes because there is a risk of foot infection which can begin with peripheral neuropathy, which is termed as loss of sensation from nerve endings damage due to diabetes, right? And also there is a poor blood flow to the feet. As a result of this, there is a delayed healing process for persons with diabetes. So how do we care for these persons? First things first, we advise that all diabetic patients should have their annual routine check done by the healthcare provider, and also for them to have a daily routine check by themselves. Now, I'm going to give you a very easy technique on how this is to be done. Okay, so for all diabetic patients, we'll say, first of all, inspect your feet, right? Make sure you open in between the toes and check if there's any sign of infection, any moisture in between your toes, or you feel a numbness, tingling sensation, or feeling of heat or feeling of coldness. If there's feeling of redness, you can feel discoloration on your feet, or there's a bruise, there's a cut or injury. All of this have to be reported back to your healthcare provider for them to give you treatment as soon as possible. Now, second thing you need to do once you've done your inspection is to wash your feet and pat it dry with a towel and apply cream on your skin, which is a lotion on your feet, but not in between the toes. Because if you apply your cream in between the toes, then it's going to leave room for maceration and for infection, which is all we're trying to avoid. And if your toenails are long, then just trim it carefully, and please not too deeply, just to avoid further injury to the feet. Right. Next thing you need to do is to check for your capillary refill by pressing on the toenail and see for a few seconds and see how fast the blood can pull back into circulation. All of this is just to help us know how healthy your feet are. Right. So if all of this is done, then we advise that you do not go barefoot because, like I said, peripheral neuropathy is really a very serious condition for patients who are diabetes. And so this loss of sensation, sometimes if you go barefoot, you could step on a sharp object without realizing you've just stepped on something, and this could lead to more injury to the already damaged nerves, which is what we're trying to avoid, right? You put on your stockings and you put on your proper shoes, your exact size or shoes that can actually give you good protection is all we're talking about here, right? So if all of this is done, then I believe we're on the right track. And also, other things we can do to help diabetes is by having a nutritious meal, and also doing our exercise regularly, like having a 30 minutes walk a day or 5 days a week, which is also a standard given by the American Diabetic Association, right? And also, we'll talk about monitoring of your blood glucose level to show for it to have a very good glycemic control. Once there's a good glycemic control, then we can avoid complications of diabetes. Then also monitor your blood pressure. We need your blood pressure to be within a very good range of about less than 130 80 millimeter of mercury. And also your cholesterol levels have to be checked by your healthcare provider. If all of this is done, can assure you that your blood glycemic control will be adequate and we can avoid complications of diabetes. But remember, foot care is really important for all persons with diabetes, and this has to be done on a daily basis. Right. So Okay, so this is what I have for you today. So please smash the like button, smash the subscribe button, and leave your comments down below. And your comments, whatever questions you want us to answer, or whatever researchable information you have for us, just let us know by leaving a comment down below. Then we'll get back to you as soon as possible. All right. So thank you, and see you in the next video. Bye.